So AJ Brown returned back to practice. That's great news. I would put him trending towards playing. I told you before, I think it's an MCL injury. That hasn't really changed from that. Possibly a mild bone bruise as well. Bone bruises, I would actually consider a little bit more concerning than an MCL injury, because a bone bruise, although it's called something that sounds innocuous like a bruise, it actually means that it's a subchondral fracture, meaning that the soft spongy bone that's underneath that exterior surface, that has been fractured. So it takes a little bit of a longer recovery period. And also pain-wise, it's also pretty significantly painful. I'd say more painful than an MCL injury. But overall, AJ Brown is trending towards playing, and he's one of those players that if he's active, you still need to start him. And this injury isn't something that would concern me enough to be worried to bench him because of any kind of production limitations or snap counts. Nico Collins also didn't practice today. They said that he's passed all of his hamstring tests, so I'm not sure why they're waiting to activate him. I mean, if you say everything's good, then you proceed to the next step. So kind of a little bit of conflict of wording there, but I mean, I still say that, especially if they're saying he's cleared all of his tests, I don't see why they wouldn't activate his window, return him back to practice. A little bit more concerned, but I still am leaning towards him playing this week. Also would be someone that I would insert right into your line. T. Higgins is listed as doubtful. My mistake yesterday, I didn't realize that they had a Thursday game. If they had a Thursday game, I already said how concerned I was about his soft tissue injury history and that he was a high risk aggravation. With that shortened weekend of not practicing on Tuesday, I definitely should have assumed that he would not play this week as well. So my mistake on that, but yeah, T. Higgins isn't going to be in your lineup this week either. And he is someone who I would be worried about putting into your lineup even if he's active. We talked about before how you got to play your studs, but with these kind of injuries, he's a high risk for getting in there, getting aggravated, and then getting pulled. Ceedee Lamb, we talked about how he had an AC joint aggravation. These are all the different kinds of gradings of an AC joint sprain. So that type 1 is the one that he had, because you really can't play through any of the other ones. So you see a type 2 is where the acromioclavicular ligament is torn. A type 3 is where the acromioclavicular and the corticoclavicular ligaments are torn, and that's when you see a significant elevation of that clavicle on x-ray. Type 4, type 5, type 6, the ligaments are all torn, but it just depends on which way and how much that clavicle is shifted, and those start becoming more of a surgical issue. So Ceedee Lamb is not going to have Dak this weekend. He's going to have Cooper Rush, but this is still an injury type 1 where you can play through it, and despite the quarterback play, he is someone that I would be inserting into my lineup based on the caliber of player he is, based on the type of injury it is, despite him likely playing through a significant amount of pain and his quarterback play. We've talked before about how there is a possibility that you can do an injection. And this is the type of injection that you do. You take a little bit of a numbing agent, so a lidocaine or bupivacaine, and then you mix it in with a steroid, Depomedrol, Kenalog. Those are all options. It's usually about 0.5 cc depending on strength, so half a milliliter to 1 milliliter. And then what you do there is you just put the needle right in between that space between the clavicle and the acromion, and you actually go into the joint, and then you inject the full fluid amount there. But you can see right there, right underneath that joint would be the lungs, and you don't want to go too deep in the needle because you can definitely puncture that lung and cause a collapsed lung or pneumothorax. That would be a very serious injury that would require hospitalization. And then also in certain situations, very rare situations, if it's not caught, the entire lung collapses, it can cause death as well. So this is not the same type of injury that Tyrod Taylor had. A lot of people were wondering about that. That one seemed to be more so an intercostal block, where we talked about they inject the steroid right along the rib for a bruised rib or rib cartilage injury, and they numb that intercostal nerve in that region. So this is a different type of injury there, or a different type of injection there. And then lastly, how do you avoid collapsing the lung? Because obviously you don't just want to bet on how deep you're going in with the needle. So this is a clear image of an ultrasound guided injection, and an ultrasound is the imaging study of choice to do these type of injections. So the light gray stuff on top, that's the soft connective tissue. Ultrasound can't penetrate through bone, so that's why you see blackness underneath this hard exterior white line, because that's where the bone is and the ultrasound waves don't penetrate through that. This bright white line, that's the needle, and it's basically the size of a very thin credit card, so you have to be very specific with the ultrasound probe to get it to line up specifically with the needle, and you want to be able to see the entire needle, because if you don't see the entire needle, you don't know where the needle is. So then you can cause some real damage. So one side we have the clavicle, the other side we have the acromion. You want to go directly into that gap right there. And you can see it's a gap because unlike the other two sides where it's just complete black, you see a little bit of gray haziness there. So that's the ultrasound kind of making it through the joint. You want to inject it right where that needle is, maybe a little bit lower to this region, but you don't want to go anywhere into this darker black region because then you're not really sure if you might hit lung in that region. So once you drop the steroid in there, it does take about 1 to 2 days to kick in, but it is pretty effective at pain control. So if Ceedee Lamb is going out there, I would anticipate that they would try and do that if he's in a significant amount of pain, or if for some reason his pain resolved quicker than anticipated, sometimes you don't need the injection. But I personally got this injury when I was snowboarding, and it was painful for about a month, and I only had a grade 1. Obviously, I don't have the pain tolerance likely of a star NFL athlete, but these are very painful injuries, and that's just one treatment option that you can use to help alleviate those symptoms.